This is a fun one. I'm Dr. Darren Smith. I'm a board-certified plastic surgeon. I've done fellowships in aesthetic surgery and craniofacial surgery. Today, I'm going head-to-head with an AI looks maxing app to see what are things I need to achieve human aesthetic perfection. Let's get into it. We'll go through its recommendations, and I'll let you know what I think. First of all, it's called Quoves, Qoves. It comes in a few different flavors. First is kind of the basic aesthetic analysis, and then they'll make non-surgical recommendations for things like fillers and Botox and skin treatments like microneedling. Then there's an add-on package that you can get where they'll actually go ahead and make surgical recommendations, which of course is where I start to get really interested in this. You can also have the big recommendations for hairstyles. There are other add-ons that you can get. They tell you that it takes 30 or 28 days to get your analysis back, and they sell an upgraded rush package as an add-on to get results faster. I did not opt for the rush package. I still got all my results back in about a week, so a lot faster than advertised, which is kind of usually the opposite of how these things go, so that was a pleasant surprise. All right, so let's get right into it. I have opened up my report in Adobe Acrobat, and I've actually cheated a little bit in that I've already gone through this. I've highlighted some key things to make sure I hit them when we go through this together. But you can essentially see this is indeed my report. There I am. We did this in July of this year, and we will keep moving on. The very first thing we see, which is no surprise at all, is that there's a nice disclaimer, which is comforting. They will say right up front, let's see if we can zoom in a little bit to see a little better here. They say right up front that this is not a substitute for a consultation with a qualified medical professional. That's me. They do not make any representations or warranties about the accuracy of their recommendations or their diagnoses, and they really want to make very clear that this is all for educational purposes and that ultimately any medical or surgical decisions need to be made by a qualified medical practitioner. Again, that's me. So we'll keep moving on here. They start with a glossary where they go through and define anatomy. And, one of the key things here to look at right away is when they are defining this anatomy, these are all, and they say at this up, soft tissue facial landmarks. Things like the subnasale is a point under the nose. The menton is a pointer projection of the chin. Gonion is the same thing for the jaw. The issue is that while all these things are certainly very important, if we're going to be doing a true in-depth analysis, especially when we start getting into craniofacial structure, which we're going to do later on in this report, you need to also actually have a specialized X-ray of the facial skeleton. It's called a cephalogram. All of the really important normative data when we start talking about what is kind of the aesthetic ideal is based on radiographic landmarks, not just skin landmarks, but where are the actual bones on the X-ray. And this is actually an area that I personally have done a lot of research on. I actually have a U.S. patent on software that I wrote that will tell you the relationship between the skin and the underlying bone when you move it in the context of craniofacial surgery. So if you were to move bone by this much, how much does the skin over that bone actually change in appearance, and what would that look like? Moving on from this nice little diagram, here's the introduction. They tell you kind of how we're going to proceed through everything. Again, we're talking about limitations. Never bad to talk about those, just so everybody knows kind of what page we're on. Another important point, and they even hit on this, they say cephalometric variability. Cephalometric refers to a cephalogram, which again is that X-ray. So there is a whole bunch of kind of normative data that for a given individual's ethnicity and gender, we know what these proportions, these angles, these measurements should be. And then you can take an individual's measurements and see where they fall within those ranges. So I've just highlighted a few that are, kind of instructive points here. There are things like the jaw width. How wide is my jaw? So it's 132 millimeters wide. And the kind of normal reference, quote unquote, is the average would be 105 millimeters. And it ranges anywhere from 76 to 136. So I'm about 26% wider than average. as maxed for my age and gender. When we keep going down here, we're looking at my forehead measurements. Height of my forehead is about 49% higher than it should be. This does not come as a major shock to me. I do have some classic male pattern hairline recession. I'm actually looking into a hair transplant, which I'll be copying that in future videos to address this. So this is not a surprise, but 49%, that's a pretty reasonable deviation from the standard. Moving along to this great section called supplementric averageness. This is one of these rare instances in which you want to be average. What we're going to get into is kind of the immediate full stop problem. If you look at this morph of what they think my ideal aesthetic outcome would be, I mean, I think I kind of look an alien here, and I wouldn't really want to look like this. So I think this is where we start to see where an application like this, while it does have some utility, and we'll get into that, it has some true weaknesses in that if there was some robot that existed that could take this data and make me look like the ideal version of myself, I'd be pretty peeved if I came out of that procedure looking like this. Certain things that's calling for, I think, are not unreasonable. For instance, they say that I could benefit from enhanced chin projection and rotation. So they make the point that my chin is a little too far recessed with respect to the rest of my profile. That's fine. I buy it. I don't think that it is necessarily rises to the level of something that I personally would recommend surgery for. If I wanted to address it, maybe I do a little fat transfer and maybe I do a little filler. The next thing that they're talking about is my nose. I happen to love my nose. I know it's not aesthetically perfect. They called it bulbous. That hurt my feelings a little bit. I mean, I don't think you really want any part of your body to be described as bulbous. And so I guess I've got a slightly bulbous nose. I'll have to kind of incorporate that into my view of myself and my core identity, and we'll see we'll see how that goes. They talk about the kind of cervical mental line, or the area under my chin, and this area is a place that I do have some kind of personal hangups about, that I don't love the way that it looks. I think I have a double chin, and I would love to have a more defined jawline. One of the ways that I'm approaching that is I'm on a weight loss journey. I'm on a GLP-1 medication. I've lost about 30 pounds so far. I'd like to lose another 30. And I think that would probably address this double chin that I have very nicely without any kind of surgery. But the real issue for me here is that while they have kind of designed their morph to reflect kind of numerical ideals, they really aren't taking into account what I think actually looks aesthetically pleasing. So they have certainly eliminated my double chin here, but I think they've also kind of made me look just not human. There are not human beings that look like this. So they've eliminated my double chin, but I don't think that they've gotten me to a good place necessarily. So they'll also sometimes go and make these philosophical comments, which, some of this is data-based, some of it is theoretical. Is a facial lift to height strongly influences how assertive or approachable a face appears in first impressions. Maybe, but there's so much more that goes into it than that. And a very important thing to remember is that all of these measurements, all of these norms pertain to the face at rest, right? Kind of the whole point of a face and the muscles of facial expression is to be emotive. And there's just so much that goes into a first impression that I would find it difficult to, again, make any aesthetic or surgical judgment based on kind of a global claim about how different proportions will affect the way other people perceive you. My face does not read as especially wide or especially narrow. I'll take it. Average in a good way. Love that. It balances vertical length with a mid-range breadth, and that tends to be perceived as measured and approachable. Okay. I'll take it. I know I just said that you can't really take too much from these measurements, but I'm kind of liking what they said, so I'm going to go with it in my own case. We can kind of keep moving there. If we divide the face into thirds vertically, my lower facial third is slightly elongated with a more compact midface. Compact midface. Okay, I'll take the good with the bad, I guess, or the bad with the good. I'll take the bad with the good, I guess. My horizontal balance is acceptable. Okay. the AI thinks that I'm acceptable in that way. So again, I'll take the win. This one, I think, really gets into another one of the issues with this app, which is, they get into analyzing my eyelids and, they're certainly not perfect and there are different procedures that you might think about. But the fact that they're bringing things up like a blepharoplasty or upper or lower without doing any kind of an exam, looking at how elastic my skin is, how my eyelid sits with respect to the surface of my eye, I think it gets very dicey to make recommendations for procedures like this without a physical exam. And it's really how you can get into a lot of trouble if somebody runs into surgery without doing the right kind of assessment for procedures like this. All right, so now we start talking about facial proportions and facial symmetry. And one thing that I thought was pretty striking is that this app, which really goes through painstakingly measuring everything millimeter by millimeter and angle by angle, did not pick up on what I think is the most prominent asymmetry on my face. Before I go and say what it is, do you have any guesses? Give you a second. My right eye is several millimeters lower than my left eye. And you can see that here. It is mentioned nowhere. And for that, you can do an operation called a box osteotomy. It's a big operation. I would almost never recommend doing it for an aesthetic purpose. It's something we do in craniofacial surgery for congenital differences. I think I kind of like the two right sides better than the two left sides. Honestly, I kind of like the right side with the left side. It's what I'm used to. I'll kind of keep it, I think. Moving along, I have been very fortunate to avoid a unibrow. We've steered clear of that one, so dodged a bullet there. I'm safe. And then as we keep going, one area that I really wanted to get into were the eyes and the eyelids, the periorbital region. This is an area that is super delicate, and any analysis of this area requires a physical exam. So the same way earlier on I mentioned that you can't do a full craniofacial evaluation without a cephalogram, you also can't really evaluate the periorbital area without a physical exam because this is a very dynamic area. Things have to move the right way. They have to have the right degree of tension. So, for instance, when they talk about recommending either an upper eyelid procedure or a lower eyelid procedure like a blepharoplasty, if we haven't established how tight my skin is here, how well the suspension is working to keep my lower lid margin in the right place, and we start talking about surgery and rush into that, you can really get into some pretty significant issues, ranging from something called ectropium, which is where the eyelid hangs out and the eye dries out, and that would cause visual problems, to a whole host of things that you just don't want to go anywhere near. So just something to be aware of. The dentofacial assessment, we're kind of looking at the relationship of the lips and the teeth to the rest of the face. They point out that the aesthetic E-line, or this diagonal line from the tip of the nose down to the lower face, they point out that both my upper and lower lips are too far back with reference to that line. This is another instance where numerically that's true. And, I could see maybe very subtly advancing things. I would certainly not do the actual operation required for that, which would be something jaw surgery where you might actually move the midface forward, way overkill. They're not recommending that. I'm just saying it's what you could theoretically do, but is really not warranted here. You could even do a little lip filler. I don't really love that look for me. I find that it can feminize male lips, so I kind of really am very careful with that. But if you look at this diagram that they came up with, and you were to actually advance my lips to where that line is, I think it would look pretty weird. So, again, take all of this with a grain of salt. Submental region. This is, another really clear example of where I think a program like this starts to fall down a bit. They say that ideally a submental region should display a well-defined cervical mental angle. So let's talk about the submental region again. This is an area, as I mentioned earlier, if I were going to have an aesthetic procedure and I'm thinking about it, I would very seriously consider chin liposuction with Vaser and face height to kind of contour my chin, my submental area, and define my jawline. But the way that this comes out here is they mention that the ideal range for the cervical mental angle, that's the angle that describes the relationship between the cervical region, which is the neck, and the mentum or the chin, should be around 105 and 120 degrees, where Mine is at 107 degrees. So if we rely on the numbers, it's really missing the point, and it's not seeing that, in fact, I do have a bit of a double chin. I have some fullness that I would actually like to address. They go on to say that there's mild fullness, but there's no pronounced double chin. I beg to differ. I think I do have kind of a pronounced double chin. I'd love it to be less pronounced. If you're just going by the numbers, I think that there are things that you're going to miss. So really, the take home with an application like this is I definitely think it's a reasonable way to start to apply objective standards to the appearance and coming up with surgical and aesthetic plans. But it really needs to be taken with a serious grain of salt in both directions. I think there are some things that it's likely to overcall and other times where it really just kind of misses. We mentioned that the application includes both a non-surgical and surgical component. While I certainly want to focus on the surgical, I'd like to touch on the way that it kind of sets things up with the non-surgical portion and the kind of basic analysis that it does. It starts out with describing why your face looks masculine or feminine. It talks about each feature set, how it contributes to that. So how do your eyebrows look with respect to kind of gender-specific standards, the cheeks, the nose, the eyes. It goes through every feature. And all of this stuff is kind of academically interesting. A lot of it is based on research. It's good kind of context. This is actually interesting. It kind of goes through talking about ways to kind of feminize a face or make a face more masculine. I don't know. These are kind of very subtle things that I don't find too jarring. It also looks at your prototypicality. And what this essentially means is it describes how closely your features match the typical features of people in your demographic group. So I am fairly typical. And overall, they've called me slightly unique. I'm okay with that in terms of my appearance. I hope my personality is a little bit more unique than that. And then they continue to go on through your facial proportions and, overall face shape and symmetry. We can go through, feature by feature. It really gets in there. It's very detailed. And I do think that there is, some utility to this degree of detail. But again, it really has to be taken with a grain of salt and discussed with someone who knows what they're doing with a medical or surgical background to actually translate what might sound good or even look good on a computer screen into something that's compatible with your anatomic reality. So AI is a great tool. I use it for all kinds of different things. It does definitely, however, have its limitations. It is not a substitute for evaluation or treatment by a board-certified plastic surgeon or board-certified dermatologist or a skilled injector. It is certainly not a substitute for a board-certified plastic surgeon, and any assessment like this that's based purely on photographs is really severely limited for any number of reasons. It's certainly interesting as a conversation starter, though. It'll be really interesting to see where this technology goes over time.